We have entered a really serious phase in our state. As you know, hospitals can now operate under what's called crisis care.
So here's the interesting thing about crisis care. So doctors will have to decide who gets treatment, who doesn't, based on staffing and other resources. So how do doctors make that very tough decision? And what does this mean for the entire state? Jamie is joining us live this morning with more on what a local doctor is saying about this. And it's important to know, Jamie, this doesn't even have to do with COVID-19. Once they get into this particular program, this is straight across the board.
Good morning to you. Well, we do have joining me the president of the Arizona Medical Association to answer our questions on crisis mode. Dr. Ross Goldberg with us this morning. Thank you so much for being here.
Thanks for having me.
Tell me about crisis mode. What does it look like inside the hospitals? What does it look like inside Valley Wise right now?
Right, crisis mode, you hear that term, you get a little nervous, right? Like, what does that mean? Basically, it's a designation for hospitals to allocate resources depending on what's going on. So we're having a large influx of COVID patients. As that number increases, which it probably will, we can then shift resources as needed to deal with that surge of patients.
We've heard of patients being treated in hallways. Is that something that's happening here? And how many beds are available still at Valley Wise?
I have not seen that in Valley Wise myself. You know, you hear these rumors of hospitals where they're treating people. It's always tricky as this kind of, you hear a lot of rumors about this. Right now, we're okay with beds. We're keeping a very close eye on things. I don't know the exact numbers off the top of my head. Fortunately, our leadership isn't really good at being transparent about the number of COVID patients we have, what's our bed availability, our PPE availability, and just really us working together as one big team to kind of get things through.
And we have not only COVID-19 patients that you're dealing with, but also people who are just here at the hospital for other medical care.
Right. So diseases don't take vacations just because we have COVID. We've got other things going on, and people still need to remember they need to see their physicians and come to the hospital like they normally would if there's a problem. I know there's a lot of fear right now about what do I do if I feel sick? I don't want to come to the emergency room. I don't want to come to the hospital. Obviously you can see I'm in a mask, but we take this very seriously. We have a lot of protective, protocols put into place to keep everyone safe. And so we really encourage everyone not to delay things because that can make it worse. So if you've got that heart condition that you need to be following up on, you need to come see us.
Are we going to start seeing the tents outside? Will St. Luke's be activated, and how would we staff that?
So I don't know about the tents. So, obviously with the 110-degree weather coming, maybe not the ideal situation. In my role, I've been fortunate that I'd be in contact with both the governor and the Department of Health Services, and they've really been good in communicating about kind of ideas and plans. I know St. Luke's is in the plans. I don't want to speak on their behalf, but there definitely has been discussions. I was actually at that announcement with the governor when he talked about St. Luke's. So we're hoping as it's needed that it triggers and they can bring people in and we can help offset some of the surge.
I know people are getting frustrated. We want this to be over. What is our doctor's orders? What can you ask of the people?
Look, I want this over as much as everyone else. As a surgeon, I'm used to wearing masks, and I don't like wearing masks all the time either. But I really need everyone to kind of participate on this. This really is a community attempt to stop the spread of the virus. Every person's important. Every person's responsible to everyone else. The wearing of the mask, the social distancing, the hand hygiene, I understand it can be frustrating. I understand it's a burden sometimes, or it's an interference with your life, but it's a short-term sacrifice for a long-term gain. The sooner we all do this and get control of the virus, the sooner we can get things back to normal.
A burden to wear the mask, but a really big burden for healthcare workers who are having to make life and death decisions. Talk to me about this scoring system right now.
Well, again, everything is always, and again, as a surgeon, comes to clinical evaluation and triaging. And you triage people based on acuity, who is sicker than who, because that's how you deal with resources in general anyway. That's how our trauma surgeons do it. That's how our burn surgeons do it. It's how I do it, when dealing with multiple sick patients. Who needs to go first? Not that they're denied care, just it's an order of who needs to go based on how sick they are and what they need in the emergent time. You take an example when we stopped the elective surgeries in March. There were people who had stuff they wanted to get operated on, a hernia, a gallbladder, but it really wasn't bothering them. So you can delay them for a little bit, not hurting them, but still can treat them and let the more urgent people get taken care of first.
Doctor, thank you so much. Thank you for your time this morning. I really appreciate you being here and sharing this information with us. It's something very concerning to us here in Arizona as we try to tackle this COVID-19 pandemic together. Back to you.
It's really concerning when you think about, just your regular emergency, knowing that if you have to go to the hospital, that this is what doctors are dealing with. Jamie, thank you for that.